it is a lovely evening actually, and a very good evening to all of you. I am Dr. Kirti, and I've done my graduation and my post graduation from National Institute of Ayurveda, Jaipur, Rajasthan. That's in India, and I have been practicing as a consultant Ayurveda in Rajasthan Hospital, India, Rajasthan, for the last 9 years, and it's a great honor to be a part of Arogyam. This is my first presentation, and I'll be expecting a lot and lot of support from all of you. Can we start the session?
Yes, yes, Dr. Mathur, thank you.
Yeah. Okay. So I'll be discussing about the chronic ailments the female world is facing. Actually, as we all know that being a man and a woman, it's a totally gender and a biologically different thing. The women in both the urban areas and the city areas, they are not proactive about their health and their well-being. Sadly, the concept of taking proper and regular checkups, it is a non-existent thing actually. And adding to it is the social stigmas and the myths about the diseases. So today here we will be discussing some of the major issues that seems like no significant complaints to us, but actually it is hampering and it is disturbing all our day-to-day lives and our day-to-day routine things. So first of all, the most common complaint the females come to me with are general weakness and fatigue. And after that, they cannot explain anything. We have general weakness and we have fatigue. That's it. So it means tiredness, it means weight gain, it means inability to do work. So there are multiple reasons actually which are leading a female to this condition. So it includes it may be maybe depression, it may be deprivation of sleep, it may be iron deficiency, D deficiency, it may be heart diseases, any thyroid condition, or nutritional deficiencies. Nutritional deficiency is a very vast word actually. It's a vast term. So I need to explain some of the things regarding this. That is, it may be frozen food that we are consuming these days. A lot of frozen food, uncooked meat. It may be processed food, and we are not having our meals on time. It may be one of the reason for nutritional deficiency may be indigestion or inability to absorb the nutrition. We are taking the nutrition, we are filling our tummy, but we are not getting the nutrition. The reason may be some liver ailments may be present there, or maybe surgeries for any gallbladder. Past history of any medical condition may be present, as hypertension, diabetes mellitus, surgeries done for breast, for abdomen, for uterus, any blood transfusions, or any history of hospitalization. There are multiple things which can cause weakness in body later on, after you get discharged from the hospital. After a week after the discharge, you feel weakness in the body. That there may be multiple reasons for that. The treatment may be, you should focus on the quality, on the quantity, and the time of your meal. You have to have your 3 meals on time. You have to have fresh food, fresh vegetables, fresh salad. The meat that you consume should be properly cooked, and avoid dairy products. Basically, I'll be instructing, or I'll be suggesting you that avoid dairy products, but you can have curd. Curd has lactobacillus in it, so we all know that it helps in digestion, it helps in healthy bacteria to grow inside our gut. So it is a good thing to consume. Other than, you can have a substitute of milk as almond milk, or you can have soya milk. The next common complaint females come to me are pain in lower abdomen. They may be it may be a dull aching pain, or it may be a stabbing pain. So dull aching pain may be due to a reason of it may be due to UTI, or it may be due to leukorrhea, or any other reason, or other lower body infections, lower abdominal infections may be present. Other than, stabbing pains may be present in kidney stones, and it may be present in endometriosis, or it may be present for ovarian cyst. So many other things, so many other elements that we will rely on. For those things, we will rely on laboratory investigations rather. But we'll talk about UTI, that is, which is a very common problem in India. It is, and I would like to hear from your side that if it is actually a problem there also. But UTI that may be due to any sexual activity which is unsafe, or we are not following the hygiene protocols, and due to urinary catheters that we use. It may be due to birth control measures. And in UTI, we feel patient always complains of frequent and burning micturition. Women sometimes ignore these complaints, but it shouldn't be avoided, as it doesn't cure if it enters in the chronic stage. And of course, it is really painful. The treatment is that so needful examinations, culture, and sensitivity tests should be done, and treatment should be done accordingly. You have to stay hydrated, that is, have 2 to 3 liters of water a day. Proper hygiene should be maintained. And after that, if the again the if the complaint persists, if the problem persists, then you have to consult your general physician as soon as possible. Estrogen is a hormone which protects our urinary tract health. But with menopause, as we advance towards menopause, the levels of estrogen fall. As a result, the urinary tract is more prone to infections. So, basically, after the age of 50, 55, which is an average age we consider as for menopause, 45 to 55 is the age we consider for menopause. So, in that age, uh, the urinary tract is more prone to infections. Other complaints are like unhealthy discharge from vagina. So, this may be due to change in the ecosystem of vagina. If we When we talk about the ecosystem of vagina, we talk about the non-pathogenic microorganisms, sorry, which are present in vagina, and they make the pH of vagina 3.5, which is very necessary so that we don't catch any infections readily, or um, as a whole, it says that it protects us from so many vaginal infections. And when we use tampons, vaginal cups, or solutions for washing vagina, the pH changes and it makes vagina more prone to infections. And when it enters in chronic conditions, it is really difficult to treat. It usually occurs after periods, so we have to maintain hygiene. That is the main thing in every ailment related to vagina. We have to maintain the hygiene conditions properly. Treatment should be we have to save ourselves from bacterial contamination. For that, we have to wipe from front to back, that is, so that the anal bacteria do not enter the urethra. The second thing is regular cleaning is very important. Post sexual cleaning is very important. After sexual intercourse, you have to urinate and you have to clean your genitals. You have to use cotton undergarments which are breathable, which reduce moisture and bacterial growth also. And of course, stay hydrated. The second reason is for vaginal infections and unhealthy vaginal discharges is multiple sexual partners. Mostly infections are sexually transmitted infections. So partner management, that is having a single partner is important, is suggestible. Nowadays, HPV infection, that is all very common, and it is also sexually transmitted infection. And persistent infection of HPV, it causes 6 types of cancers in women and almost 3 types of cancers in men. And it is a big cause of genital cancers these days. Now we proceed towards other complaints like lower backache, pain in limbs, joint pains. These may be due to pelvic inflammatory diseases. With advancement of the age, these complaints are more common. And low bone density, that is osteoporosis, that is the very common reason these days in females, because after the age of 40, we don't consume the supplements we need, our body needs. And these supplements we cannot get from our food. Actually, the absorption capacity of body reduces. We have to have supplements, we have to give body something extra. uh, Proper nutrition should be there, and diet rich in calcium, magnesium, vitamin C. etc. If or after all these supplements, after all these treatments, if we are having any alarming situation, any abnormal or intense pain in the lower back or in limbs or in joint, so you have to go to your general practitioner and you have to see. Chronic headaches, these are also a major problem with the females from the age of 35 to till menopause, actually, because estrogen is the reason. Estrogen protects, estrogen hormone is a cardioprotective hormone, basically. We say that, but it protects us in many other things also. So don't take any self medication for that. Go get screened yourself by your general practitioner. Avoid triggers, avoid trigger causes, go for proper blood investigation, and regular body checkups are very important. Take proper sleep, stay hydrated, eat your meals on time, and avoid stress. This is the only way, and the medication should be only under the supervision of a practitioner. Other than that, some of the other things, other complaints like breathlessness, dyspnea, palpitation in your day-to-day work, these can be related to anemia. It can be related to cardiac diseases or as hypertension, etc. One more complaint, the old age females come to me with loosening of perineum and vagina. This is as the age advances, the laxity of lower part of vagina leads to prolapse of uterus. The same happens with the bladder and the same happens with the rectum. The perineal region, the laxity of perineal region causes prolapse of your bladder and prolapse of rectum also. So the patient complains of dribbling, urine, and inability to pass urine. It causes some difficulties in sexual intercourse also. So treatments, how to manage these things at home, uh, that should be examined. First of all, it should be examined properly and consult the physician on time. Other than that, yoga and physiotherapy are of great help in this condition. They will tell you how to do the exercises of that particular part to contract the muscles so that it will help you in you will help, it will be of great help. Then diabetes mellitus, we'll be talking about diabetes mellitus. It can also affect your reproductive and your sexual health as a woman, because it causes decreased sexual desire, it causes fungal infections of vagina, itching and curd like vaginal discharges occur. Diabetes later on affect on multiple organs of our body like eyes, the blood, vision, kidney, liver, and everything. Digestion to uh, multiple organs are involved. It is, but still, it is a manageable disease till the time it doesn't enter the chronic stage. Sudden weight loss occurs, excessive thirst, excessive hunger, extra sweating, it occurs. So treatment should be get your blood sugar levels checked regularly. Dietary restrictions should be given, like dairy products should be avoided. Meat, sweets, sodium, highly processed foods, etc. should be avoided. And you have to be physically active. Some of the complaints are hypothyroidism, which has dryness of skin, weight gain, hair fall, dullness, poor metabolism, etc. So you have to go and check your thyroid profile, and accordingly the treatment will be given. Hypertension, it is also a major problem these days, actually, directly related to stress, to anxiety, to depression. So the symptoms are maybe like headache, giddiness, palpitation, nausea, vomiting, and regular checkups are necessary, actually. And don't go for self medication. I would suggest in every condition, please don't go for self medication. Go and see your general physician. He is the only one who can help you. Something Postmenopausal syndrome. We'll be talking about postmenopausal syndrome. Postmenopausal syndrome, menopause means 12 straight months without periods, occurs between 45 to 55 years of age. And the most common and the biggest symptoms are hot flashes and night sweats. trouble sleeping, joint and muscle discomfort, low mood, anxiety, etc. When it occurs between 40 to 45 years of age, it is early menopause. And in this condition, it can be diagnosed in laboratory reports as the increased FSH levels show that it is early menopause. And treatment may be vitamin D is the best supplement. Other than that, you can give calcium 1200 mg per day. The last and the most important thing I'll be discussing is depression. Nowadays, mental health is just as important as physical health. It affects women's ability to work, to sleep, eat, and feel happy, and she feels low confidence. So, it can be due to stress, it can be due to trauma, it can be due to unrealistic goals or dreams that are not fulfilled, it can be due to bad relationships, reproductive or psychological factors. So many things are possible. This is all man to man dependent things. As age advances, women in their perimenopause and postmenopause phase experiences depression. This is a very common thing these days. And so, what you have to do is just take care of yourself. It's okay to not feel okay. So, get help from a professional, maintain connections, stay connected with your friends, with your relatives, or anybody is around you. Eat well, sleep well, indulge in social activities, but don't depend on sleeping pills and anti-anxiety pills. These are your real enemies. Don't depend on any sleeping pills or anti-anxiety pills. Don't self medicate yourself. Yoga and physical activities will provide you so many benefits and power to come out from this dilemma and confusion. Spend time with yourself, acknowledge yourself. This is the last thing I would like to suggest to all the females, to the whole female world. Please don't take stress, and feel happy to be in your body. Thank you so much.
That's a wonderful reminder, Dr. Mathur. Happy to be in our body, and it's a privilege to be, but it's a roller coaster. So I will, if it's all right, I would like to stop recording because I think there's a lot we would love